And Dr. Megan Srinivas is represents Iowa House District 30 on the south side of Des Moines. And she was first elected back almost 2 years ago, year and a half, I guess you would say. And I was fortunate to help a little on her campaign, so I know a little bit about her. So, Megan, we're going to give you like the first 5 or 6 minutes. Talk about anything you want. Talk about yourself and your campaign. Then after that, I'll give you 2 or 3 questions. Then we'll close it up. Okay. So the floor is yours. I don't know. That camera's going all over the place. Looks like you were on the floor there a minute ago. So, so the next 5 or 6 minutes are yours.
Sounds good. Hi, everyone. Thank you so much for meeting with me today and for reading my questionnaire as well. I am very excited to be here with you all. Many of you were a part of my original campaign when I ran and have been people I have been honored to work alongside in activism even prior to running for office. Honestly, the reason I ran was because of what I saw every day in the community. When I treat patients, if they can't even afford their medications, if they're worried about paying rent, if they're worried about how to even get transportation to the job the next day, or how they're going to feed their kids, there's no reason why I can talk about blood pressure medicine with them, because the overall structure in which they live is hindering them from really leading the lives they deserve to lead. And I couldn't change that with my prescription pad, but I could change that if I can be a part of changing the system in which we operate. So that's why I ran. And there are so many issues that I ran to help with. Everything from mental health and comprehensive healthcare access for everyone, to reproductive health rights, to making sure our public schools and all school staff are adequately funded, and even just ensuring that people can get by working one job instead of needing 2 or 3 and still worrying about how they're going to feed their families. That work I definitely have started to try to do in the legislature these last 2 years, but there's still so much to do. I've been very fortunate to form relationships across the aisle as well. And as I was actually able to get 2 bills passed in a bipartisan manner all the way through the legislature this year that I authored, and even got the governor's signature on it. Both are looking at healthcare access. And the first one is really trying to make sure that every single Medicaid and insurance company actually is required to cover testing to help blood testing that helps determine what disease somebody might have. It's called the biomarker bill. And basically, it's everything from testing we do for cancer to testing we do for looking for infection to looking for rheumatoid arthritis or lupus or other autoimmune diseases. But these are tests that help to save people's lives and help to do it in a non-invasive way. Because if I can take a blood test and see if you have an infection rather than having to go in and take a biopsy, take a tissue sample that requires surgery, I can save you pain. I can save you having to take time off from work, and I can get you better care faster that's more affordable. And that was unfortunately not being covered by too many companies because they were trying to prevent people from getting access to the care they needed. So we mandated this year, it'll go into effect July 1st, that insurance, including Medicaid, because they wanted a Medicaid carve out and we fought against that, has to cover this type of testing. We also did something to help reduce what we call prior authorizations, which means that an insurance company, specifically non-medical switching, which means an insurance company can come in, and if I prescribe you, Mitch, a medication for your diabetes, and we know that it's a medication that works for you, we've tried other medications, regardless, whatever, we have a pre-existing relationship as doctor-patient, and we know this medication works, but the insurance company suddenly says, you know what? We got this medication for a lot cheaper from our pharmacy that we're working with, so we're going to switch it out without even telling your doctor. And you then have a bad outcome because in about 20% of these cases, the medication switches actually are not equivalent and can end up having people go back to the hospital. We passed a bill this year that I helped to author that would prevent that from happening. They no longer are allowed to do that anymore. They have to notify the doctor, but even if they notify the doctor, I can stick my foot down and they cannot change that medication for the next year. So these are small victories that will actually help save lives and help save patients, but they're just the foundation of what I want to build upon in order to make sure people get access to the life that each person deserves to live. And that's why I'm running again.
Well, thank you, Megan. I appreciate that. You actually took less than 6 minutes. That's pretty good. There's a lot of time for questions then.
Sounds good to me. Ask away.
Okay, well, we'll go to our first question. This is under education, and it's question 1B. And this, the governor recently introduced a bill for 50,000 starting wage salaries for teachers. And of course, it passed along with other items in the bill too. In your opinion, is this sufficient? If not, what should the starting salary be? And of course, we did get your answer, but we just wanted to look at. I mean, are you looking at a certain number for starting teachers versus teachers who've been around for 10 or 15 or 20 years? So I'll give it to you. It's your question.
So there were two versions of a teacher salary bill that were voted on in the House and the Senate this year. The worst one passed, neither were great. And the reason I say this is multiple. First off, the $50,000 base salary that they have listed in there, or minimum salary, I should say rather, includes every input that the school district is putting in, meaning it's not just your actual salary, it also includes the cost of benefits. So your 401k, your insurance, all of those benefits, which means there isn't a school district in Iowa that doesn't already meet that $50,000 threshold. That means that your salary in many places, depending on how your health insurance benefits and retirement are staggered, could be as low as 35,000 still with this, which is a pittance. 50,000 does not cover what we need. The exact number, I would have to sit down and take a look at our education budget and talk to really the people who are experts in this field and determine what an exact number is. But I can tell you right now that 50,000 is far, far too low. And that number needs to be, especially if we're being all encompassing, at least $10,000 higher just for entry level teacher if we want to even be on par with our neighbors. Secondly, the other aspect of the bill that did end up passing completely took out the increase in salary for veteran teachers, meaning that sure, we have a minimum level when you first enter, but we're not prioritizing retention. And as much as it's great to keep our teachers and hire new teachers, especially when they're getting trained at some of our great universities here, but we need to also keep our talent, because that wisdom that you gain as you're part of a school system, that wisdom you gain that you then impart into no incoming teachers, that is invaluable. And why are we letting some of our most talented people be exported to other states because we don't value them? So that is a huge issue with this bill. The other issue with this bill too, and in the original version, there was a standard for increasing support staff pay. So this includes paraeducators as well as other types of support staff. And there was a minimum wage. It was $15 per hour, which is far lower than what it should be. Even just to make a living wage, I strongly stand behind at least $20 per hour. That said, though, the version of the bill that ended up passing completely took out that minimum. And we don't live in a vacuum. Everybody in our school systems work together to help support and educate those students. And we need to ensure that every single person is getting paid a certain amount of money that enables them to live the quality of life they deserve.
Well, thank you, Megan. I do appreciate that. Well, we have one additional question that's also under education, and it's question number 2 under education. Should public post-secondary education, including trade schools, be free to students? What limitations would you apply? And I would say with your answer, I mean, you did well in your answer, but we always try to push beyond just the 2 years of community college and trade schools. So give us your perspective. You have about 4 minutes. You have up to 4 minutes to answer that question.
Well, I'm a strong believer that public education should be free and accessible to all. And that includes anybody who lives in Iowa. But the reality of the situation is the makeup in which we currently live. We can't institute this all at once together, which is why in my answer, I concentrated at first on doing the lower hanging fruit, where we could do within our budget today, we could easily implement doing it for community colleges and trade schools, and then building up towards getting a 4-year program for free if they're public education. I strongly believe that's where we need to head. It's just going to be stepwise fashion before we can get there.